Welcome back, everyone. Today we're going to cover the lower extremity for myology. We'll try and do it in an organized fashion where we will cover the hip. We'll start with the hip, then we'll go down to the thigh, and then we'll go down to the leg and talk a little bit about the foot. We'll do it in a fashion where we'll talk about the muscles from the anterior hip, then we'll look at the posterior hip, we'll look at the lateral hip, and then we'll look at the medial hip. We'll look at the thigh in the same fashion where we'll look at muscles from the anterior view, we'll look at them from the posterior view, we'll look at them from the lateral and the medial view. And then we'll look at the leg, and we'll look at it from the same fashion where we'll see what we can see superficially from the anterior view. We'll look at it from the posterior view. We'll see what we could see from the lateral and the medial view. The best way to approach it. So when we look at the top here, when we look proximally at the top, we'll see, and remember some general rules of thumb as well. When we're looking at muscles, if they cross the joint, they have to move the joint. We do know that. And if it crosses it in the front, it's got to move that extremity to the front. Now you just have to figure out, what is that forward movement called? Is it always called flexion? No, it's not always called flexion. At the hip, yes. At the knee, no. And then at the foot, you have to be more careful because there's two different types of flexion. There's plantar flexion, and then there's dorsiflexion. And you have to know what those differences are. So again, please make sure you review my older videos that I've done, and where I lecture and demonstrate the ranges of motion, and I actually perform what they look like. And I even go over primary muscles or prime movers that perform those actions. So you're not just memorizing something, you can actually see the actions being performed, okay? Okay, so let's look up at top, and you'll see that we have psoas major and iliacus. So these two muscles are on the anterior hip, and they are primary hip flexors. When we take the psoas major and the iliacus, you'll see that both of these muscles travel inferior, or deep, I should say is the better word. They do travel inferior and deep to the iliacus, to the inguinal ligament. So right here in gray, you see the inguinal ligament going from the anterior superior iliac spine to the pubic tubercle. The psoas major and iliacus travel deep to it. They go down and they insert onto the femur, onto the lesser trochanter. Remember, on the humerus, there's a greater and lesser tubercle, but on the femur, there's a greater and lesser trochanter. The psoas major and iliacus, they are two separate muscles, but they blend in together deep to the iliacus. They blend in and they have one attachment site on the lesser trochanter. And these two muscles are now referred to as one muscle called the Iliopsoas. We take these two names of muscles, we combine them, we call it the Iliopsoas. Psoas major originates on the lower lumbar vertebrae and their discs. You can see that here's a lumbar vertebra, here's a lumbar vertebra, and you could see that the muscle fibers cross over the vertebrae, but also attach to the intervertebral discs. And they are one of the possible causes of disc herniations. When these muscles pull really hard, they can tug on those discs and bulge and herniate them, especially when people do sit-ups. A lot of people hurt their lower back from doing improper sit-ups, and the sit-ups are one of the worst exercises that people can do. The reason why they're so poor is that when you do a sit-up, people have to remember that or learn that all of the abdominal muscles are not fast, rapid movement muscles. They're not acceleratory muscles. They weren't designed to accelerate for speed. Those abdominal muscles and core muscles were designed to stabilize the spine. But yet, when you look at crunches and you look at doing sit-ups, they're very fast, rapid movements. So the best way to actually train the abdominal muscles are stabilizing exercises such as planks. So this muscle here brings me a lot of patients to the office because especially from athletes, when they do sit-ups, they tend to bulge and herniate discs, and the psoas major is one of those triggers. The iliacus originates on the iliac fossa, right? So now hopefully you're starting to understand the connections of why I had asked some of these landmarks on your osteology exam, was because I was trying to make connections and planting seeds to make you think, all right, these bony landmarks are critical and important to understand, and now you're seeing them again when we do myology. You know, the iliac fossa, that depression on the this portion of the ilium. I already mentioned the ASIS, the anterior superior iliac spine. We mentioned lesser trochanter, so now we're speaking a language that we all understand. You should be comfortable with those landmarks. So those two are hip flexors. Now let's just look at what we can see superficially here in front of the thigh, where the femur is. So here's the ASIS, the anterior superior iliac spine, and you can see this upside down V right here. So there are two muscles that originate on the anterior superior iliac spine. One is the longest muscle in the body, called the sartorius. That's the longest muscle in the body. Second longest muscle happens to be this one here, which is an adductor, adductor. That's called the gracilis. That's a medial thigh muscles, but we can still see it here. So longest muscle is the sartorius. And then we have the short muscle called the TFL, tensor fascia latae. It is your Starbucks muscle, your tensor fascia lata, tensor fascia latae. Very short muscle. This muscle originates on the ASIS and it inserts on this structure here. Now I'm going to zoom in on it because it kind of gets camouflaged with the background. That's this bluish grayish. But right here on the ilium, we can see a little bit of this soft tissue structure here. If we follow it down, it kind of blends in with the background. But if you look in closely, you can see that there's this structure here, this band called the iliotibial band, because it goes from the ilium to the tibia. So it's called the iliotibial band, aka iliotibial tract. So the TFL, the tensor fascia latae, originates from the ASIS and inserts on the iliotibial band or iliotibial tract. There's another muscle that originates on the that inserts on the iliotibial band. We just can't see it from this view. When we rotate the hip to the side or to the posterior view, we'll see the gluteus maximus, the large rump muscle. That too inserts on the iliotibial band. Sometimes you'll hear me say ITB. ITB stands for iliotibial band. Okay, the TFL, tensor fascia latae, that's a hip abductor. It brings the hip out to the side, but because it originates and there's a portion of the muscle that's anterior, it can flex the hip as well. The sartorius is what I refer to as the Faber muscle, and you'll want to write that down, Faber, F-A-B-E-R, F-A-B-E-R, Faber. I call it my favorite muscle, Faber, F-A-B-E-R. The mnemonic there, Faber, F-A-B-E-R, stands for flexion. That's the F. The A-B is abduction. And then the E-R is for external rotation. So Faber, hip flexion, abduction, and external rotation. Faber, F-A-B-E-R, flexion, abduction, and external rotation. When you perform all of those movements together, hip flexion, abduction, and external rotation, we call that the Tailor position. A tailor is a person who sews, and typically they would put their leg in a figure 4 position when they're sewing something. So it's the figure 4 movement when you're sitting with your legs crossed. That's hip flexion, hip abduction, and hip external rotation. Remember, when you're asked actions, what is the action of a muscle, you put the joint first and then the action. So it's hip flexion, hip abduction, hip external rotation, not external rotation of the hip, flexion of the hip, abduction of the hip. That's not the appropriate way to do it. Okay, so let's see what else we have here. We can also see in the front of the thigh 3 of the 4. There are 4 quadriceps, hence the name quadricep. Quad means 4. So quadricep is 4 muscles, but superficially we can see 3 of them. 1, 2, 3. The one that's mostly centered is the rectus femoris. The one that's on the lateral thigh is called vastus lateralis. And the one that's on the medial thigh is called the vastus medialis. So lateral, vastus lateralis, medial, vastus medialis. Vastus just means immense, and these muscles are pretty large and immense. The rectus femoris originates inferior to the ASIS. So what's inferior to that is the anterior inferior iliac spine. The anterior inferior iliac spine. That's where the rectus femoris originates. But all the quadricep muscles, let's look at their insertion. We could see that there's a little bit of a tendon here. Then we see a bone right there. That bone is the patella. And then we see that it crosses over the patella and attaches to the tibia right here on this bump. So now you have to think back to osteology. What is this bump right here? This bump is the tibial tubercle, aka tibial tuberosity. So all of the quadriceps cross over the patella and insert on the tibial tubercle. So technically, by name, this structure here, what is the soft tissue structure called when it goes from a muscle to a bone? When you have an attachment from a muscle to a bone, we call that a tendon. So this is called the patellar tendon. Sometimes it's called the quadriceps tendon. Well, then what is it called when it goes from the patella to the tibial tubercle? By definition, something going from a bone to a bone is called a ligament. So we would have to call this the patellar ligament. Above the patella is the patellar tendon, below it, the patellar ligament. That's if we are referring to it from a structural perspective. But if we're talking about it from a functional perspective, this would be the infrapatellar tendon. This is the patellar tendon. This is the infrapatellar tendon because it's below the patella. But they are a continuous structure. We just can look at it from a structural perspective or functional. Structural because tendons go muscle to bone, ligaments go bone to bone. Okay, let's go back here so we can see 3 of the 4 quadriceps. So where's the 4th? The 4th quadricep is hiding underneath the rectus femoris. When we look at the rectus femoris, we'll see that right here, there's a cut. And that's because we can take this muscle off, we can dissect it and see what's deep to it. and there is the fourth quadricep hiding deep to the rectus femoris. That fourth quadricep is called vastus intermedius. Intermedius because it's in between the lateralis and medialis. So you have the rectus femoris, the vastus lateralis, vastus medialis, and deep to this one, the vastus intermedius. All four of those quads cross over the patella and insert on the tibial tubercle. All four of those quadricep muscles will extend the leg or extend the knee. So it's a forward movement of the leg, right? So typically from the upper extremity, anything that goes anterior is always flexion, right? Flexion of the shoulder, flexion of the elbow, flexion of the wrist, flexion of the fingers. But when we look at the lower extremity, you are moving the lower leg forward, but that's not called flexion, it's called extension. By definition, right, extension, flexion is when you decrease an angle, right? So if my arm is straight and that's a 180-degree angle, now I'm bending my elbow to 90 degrees. That's flexion. When the knee is bent, that's flexion. When you're extending it, you're making it a straight line, which is 180 degrees. Okay? The rectus femoris is the only quadricep muscle that crosses two joints. It crosses the knee, but I said it originates on the AIIS, so it crosses the hip. So the rectus femoris can flex the hip and extend the leg. The other three only do leg extension because it doesn't cross the hip. Okay, what else can we see here just to orient ourselves? This is the pubic bone. So what we can see on the inner thigh, remember, if a muscle is in the front, it brings it to the front. If a muscle's on the outside, it brings the leg or the thigh to the outside. If a muscle's on the inside, it brings the limb to the inside. So what do we call that movement when you're bringing something towards midline? We call it adduction or adduction. So the pectineus, the adductor longus, and gracilis, these are all inner thigh muscles. They're all adductors. That's their primary movement. They can all do other actions as well, but their primary movement is going to be hip adduction. Let's look at what we can see from the anterior view here as well. We see in the anterior compartment, that's what we refer to the front of the leg, anterior compartment muscles. The back, we'll refer to them as posterior compartment. So in the anterior compartment, we have this very important muscle that's in the anterior leg that goes to the inner foot, and that's called Tibialis Anterior. Kind of like the forearm, if you think of the forearm muscles where we had muscles that originated on the medial epicondyle, and then they come down and they cross the wrist, and they can flex the wrist. So muscles that are in front of the tibia that cross the ankle are going to act on the foot, just like muscles on the anterior forearm can flex the wrist. If it's on the posterior forearm, it extends the wrist. When you have muscles in front of the leg, they dorsiflex the foot. Muscles on the posterior compartment plantar flex the foot. Plantar flexion is stepping on your tippy toes. Dorsiflexion is standing on your calcaneus or your heels and walking on your heels. So the foot doesn't have an extension and flexion name. It has a dorsiflexion and a plantar flexion description. So tibialis anterior is a primary foot dorsiflexor. But since the muscle also inserts on the inside of the foot, the other two actions of the feet are what we call inversion and eversion. There's inversion of the foot, and then there's eversion of the foot. We spoke about this a little bit when I talked about osteology in a previous lecture, and we compared the lateral malleolus to the medial malleolus. And we said that the lateral malleolus, which was the distal end of the fibula, descends further distally than the medial malleolus, which is the distal extension of the tibia. And because the fibula descends further down than the tibia, the action of foot inversion is much easier than eversion, which is why if you slip down the stairs or trip off a curb, your foot not only plantar flexes, but it inverts as well. And when you plantar flex and invert, or your ankle rolls in, as people would say, you happen to sprain and strain a lot of the soft tissue structures around the lateral side of the ankle. And that's where this becomes all swollen and black and blue. And that's because all of the ligaments are overstretching past their anatomical position, right? When soft tissue structures beyond their anatomical limits, and they are ligaments, we call it a sprain. When they are muscles or tendons that are stretched beyond their anatomical limit, we call it a strain with a T. So sprains and strains can happen. So what does the tibialis anterior do? It's a dorsiflexor of the foot, right? Foot dorsiflexion or ankle dorsiflexion, and foot inversion or ankle inversion. The extensor digitorum longus, which is this belly of the muscle, that too, if we look at it, it crosses the ankle and attaches to digits 2, 3, 4, and 5. So that's called the extensor digitorum longus. Now, because it crosses the ankle, it's got to dorsiflex the ankle, and it crosses the toes, so they extend the toes. They extend the toes. On the posterior side, right, here's the great toe, here's the Iliacus, but we can see a little bit on the medial aspect, these two muscles on the posterior compartment called the Gastrocnemius and the Soleus. We'll take a closer look at it when we're looking at it from the leg from the posterior view. So this is more of a superficial view of the entire lower extremity from the front and what we can see. Okay, let's go back to the main and let's look at, since we looked at the anterior thigh, let me zoom in and show you, whoop, here we go. Okay, let's get our orientation back. This structure right here was the inguinal ligaments. You could see the pubic tubercle and the pubic symphysis here. We could see a little bit of the psoas major right there. Now, it's the anterior superior iliac spine right here that's kind of obstructed or blocked in the picture. But I can see two tendons here and here. This one would be the TFL, the tensa fasciae lata, which would come down and attach to the iliotibial band. This one here is the rectus femoris. That quadricep is cut. It's cut, and here's the other end, right here. So from here to here, from here to here, that would be the rectus femoris. I just want to correct myself on a mistake that I made. So the mistake that I made before, here is the TFL, the tensa fasciae lata, that's cut, that goes in this direction to the tensa fasciae latae, to the iliotibial band. You can see it here, the ITB. Here's the proximal portion of the tensa fasciae lata, and right here is the distal portion of the TFL that's cut. So it would go from here to here. This one here is the sartorius that's cut. This one here is the sartorius because it's pretty superficial. What's deep to it That's the rectus femoris. Proximal tendon is the rectus femoris, the distal tendon. Here's your vastus lateralis, here's your vastus medialis, there's your vastus intermedius that was deep to the rectus femoris. Here is the pectineus, that is a hip adductor, and here's your adductor longus, another hip adductor. Okay, so that's the anterior thigh. All we did was dissect and pull away the rectus femoris. The rectus femoris goes from the anterior inferior iliac spine to the patella, then crosses over the patella and inserts on the tibial tubercle. The sartorius originates on the anterior superior iliac spine. It comes down on this oblique angle and inserts on the medial and slightly posterior portion that's medial to the tibial tubercle and posterior to it. I'll show you on another view. Okay, staying on the anterior, since we're on the anterior, let's go down to the anterior leg and show you what we have here. So here is the tibialis anterior. Here's the tibialis anterior. We can see that it comes down there and inserts on the inside of the foot. Here's the great toe. So tibialis anterior, we said, is a dorsiflexor and inverter of the foot. Lateral to it is the extensor digitorum longus. When we look at the belly of the muscle, it goes underneath the extensor retinaculum, just like you had an extensor retinaculum of the wrist and a flexor retinaculum. You have a extensor and flexor retinaculum of the foot. This is the extensor retinaculum that holds down the extensor tendons of the toes. So this is the extensor digitorum longus going to digits 2, 3, 4, and 5. The extensor hallucis longus, we can see a little bit of the tendon here. It's deep, right? It's deep to the EDL. It's deep to the extensor digitorum longus. But you could see a little bit of the tendon right there. There's a separation or a split between extensor digitorum longus and extensor hallucis longus. That's why it says beneath. And that tendon comes down and it goes this way to the great toe, extensor hallucis longus. It extends the great toe. It's one of those muscles that's involved with bunion formation, also known as hallux valgus, because the belly of the muscle is here, right? It's underneath the EDL, which is more on the lateral leg, but the insertion is on this diagonal on the medial foot. So when you have this line of pull going from lateral to medial, it can take the great toe and deviate it, creating a bunion. Okay, so we did a little bit of the anterior hip, the anterior thigh, and the anterior leg. Let's take a look now on the posterior. Let's go to the posterior thigh. And what is superficial here is the gluteus maximus. Now, the gluteus maximus was that other muscle that inserted on the iliotibial band. You could see it here. The TFL, tensa fasciae lata, was the other muscle. So here's the gluteus maximus. It originates here on the sacrum and a little bit of the ilium, the posterior ilium. And the insertion is on the iliotibial tract or the iliotibial band. It is a primary hip extensor. It is a strong extensor of the hip. That is your stairmaster muscle, or the muscle that helps you go from a seated position to a standing position. That's called hip extension. Now, if we were able to dissect, and we will, another image, the gluteus maximus, it would allow us to see the hamstring muscles, at least the origin of the hamstring muscles, really clearly. So on the posterior thigh, there are the hamstring muscles. On the anterior thigh, you had 4 quadricep muscles. On the posterior thigh, we have 3 hamstring muscles. Let's look at the hamstring muscles. So the hamstring muscles are 2 of them. There are 2 of them that are on the medial aspect of the posterior thigh, and there's 1 of them that's on the lateral aspect of the posterior thigh. Okay, so this gives you the full view. So you can see here's the pinky toe. So this is all lateral. And then the great toe is here. So this is all medial. So the 2 hamstring muscles that are on the medial side of the thigh are the semisisters, the semimembranosus and the semitendinosus. Semimembranosus is the one that's more medial, right? It's more, it's deeper, midline. And the one that's more superficial is the semitendinosus. So you have semitendinosus, and the one that's more medial or midline would be with the M membranosus. That's deeper. The lateral one is the bicep femoris, and again, bicep means 2. So there's 2 heads, a long head and a short head. The short head is deep to this, but here's the long head. The 3 hamstrings, semitendinosus, membranosus, and the bicep femoris, all have the same origin. They all originate right here on the ischial tuberosity. That should sound familiar as well. Ischial tuberosity. Their insertions are different, of course. The bicep femoris is lateral, so that inserts on the head of the fibula, and the semitendinosus and membranosus are going to insert onto the tibia. The semitendinosus has a very specific insertion on an area called the pes anserine, as does the gracilis. The gracilis comes down here and has the same insertion right here. It looks like a goose foot, and that's what pes anserine actually means. It means goose foot. There are 3 muscles that attach here on the pes anserine. It's the sartorius, the gracilis, and the semitendinosus. So sartorius, gracilis, and semitendinosus all insert right there on the pes anserine, which is medial to the tibial tubercle and slightly posterior. So we can see that better from a medial view, and I'll make sure I show that to you in a second. Here is another adductor. We can see it from the posterior, and it's called the Adductor Magnus. Remember the Adductor Longus you could see from the anterior view. There's an Adductor Longus, Magnus, and Brevis. We saw the longus, here's the magnus. Now, on the posterior, if we move down to the lower leg, we can see the superficial muscle called the gastrocnemius. Now, there's 2 heads to that muscle. There's a medial head and a lateral head. So if you ever asked on an exam to label this, you can't just say, well, you could say gastrocnemius, you just wouldn't get full credit, right? It's like if you were asked the biceps and it's pointing to the long head for full credit, you would say long head biceps brachii, short head biceps brachii. If it's the triceps, is it the long head, lateral head, or medial head? When you're talking about the gastrocnemius, is it the medial head or the lateral head of the gastrocnemius? If you look inferior to it, here's the infamous Achilles tendon, named after Achilles, or the real pronunciation would be Achilleas. Achilleas is the appropriate name in Greek, but we call it Achilles. And then deep to the gastrocnemius, we see the soleus muscle. There's a little bit here. That belly is soleus. That line right there is the soleus. And on this side, it's the soleus. But it's deep to both medial and lateral heads of the gastrocnemius. Both the gastrocnemius and the soleus come together and contribute to the Achilles tendon, sometimes also called the calcaneal tendon, because this is the calcaneus. These are posterior compartment muscles, so they plantar flex the foot. Foot plantar flexion or ankle plantar flexion. Okay, so we did the posterior compartment here. Let's just zoom in a little bit here, see if there's anything else I need to show you, or if this shows anything a little bit better. Okay, we did the Adductor Magnus, we did the gracilis, which is the second longest muscle in the body. It originates there on the pubic bone. If we follow it down, it inserts on the pes anserine. Here's the semitendinosus. It originates on the ischial tuberosity, and it too inserts on the pes anserine. So we can see our three hamstrings, 1, 2, 3. These hamstrings, since they cross the hip, they extend the hip, or hip extension, and they cross the knee, so it's knee flexion. They are responsible for hip extension, but knee flexion. That's what the hamstrings do. Let me look at the posterior hip, and we're going to dissect the gluteus maximus. I want to cut that away. So here's the gluteus maximus that's cut right there. And what's deep to it is the gluteus medius. So the gluteus maximus was a hip extensor. The gluteus medius is a hip abductor. The gluteus medius is a hip abductor. It's also a hip stabilizer, meaning if you were standing and you bent one knee off the ground, so your foot is off the ground and you're balancing on one foot, the foot that you're balancing on, let's say your left leg and foot is on the ground and your right one is bent off the ground, your left gluteus medius is responsible for keeping your pelvis level. And if you do that and the hip drops, that's a weak gluteus medius. You should be able to raise one foot off the ground, keeping your other leg on the ground without your pelvis dropping or tilting. We call that Trendelenburg's test. It is a great test to assess the integrity of the gluteus medius muscle. With the gluteus maximus cut away, we could see these small intrinsic muscles of the hip. They all are responsible for hip external rotation. Hip external rotation looks like this. If you point your toes out, it's your femur that's rotating out and your feet just come along for the ride. So that is hip external rotation. So these muscles here, the piriformis, the gemellus superior, gemellus inferior, obturator internus, and there's also an obturator externus that we can't see from this view. It's from the internal view. And then there's the quadratus femoris. So these short muscles, they all insert on the greater trochanter. They all externally rotate the hip. The piriformis, there's a little typo here. It should be P-I, right? P-I-R-I. It's not P-Y, so there's a typo there. Piriformis is spelled P-Y-R-I-F-O-R-M-I-S. This piriformis is a famous muscle because if we look at it, it's a landmark. When you find the sciatic nerve, which is this yellow nerve here, you could see that superior to the sciatic nerve is the piriformis. So when this muscle is in spasm, it tends to hit and trigger the sciatic nerve, creating what's called sciatica. The other thing I want you to see in this view is now that the gluteus maximus is cut out of the way, we can now see where the hamstring muscles originate, and that's the ischial tuberosity. So you can see the medial and the lateral hamstrings. Okay, let's look at the posterior. Since we looked at the gluteus maximus here, we looked at the hamstrings, we also looked at the posterior calf. Now we did the posterior hip. We did the posterior thigh. Let's look at the posterior leg, why don't we? Let's see what's down there. So from this view, this is the posterior leg. All we did was dissect and pull away the medial head of the gastrocnemius. So it says here, gastrocnemius, medial head removed. This is where the medial head was removed. So this portion is the lateral head. I don't want you to get confused. The arrow is pointing here. That is the lateral head of the gastrocnemius. The medial head was dissected away. It was dissected away so we can see what's deeper to it. We could see the soleus. We could see it here, and we can see it here, and we can see it here. So what is this? This right here is a third plantar flexor and a third posterior compartment muscle of the lower leg, and that's called the plantaris. It would be analogous to the palmaris longus of the forearm. We have a plantaris here. It does cross the knee, and it's got a really long tendon like the palmaris longus does, and it too contributes to the Achilles tendon. So the plantaris, the gastrocnemius, and the soleus, all three of them are responsible for foot plantar flexion. Foot plantar flexion. There's this last muscle here that runs on this oblique angle, and it's called the popliteus. The popliteus is the key that unlocks the knee. The popliteus muscle is called the key that unlocks the knee. Why is it the key that unlocks the knee? It's the key that unlocks the knee because in order to initiate knee flexion, in order to initiate flexion of the knee has to first unlock. And in order to unlock, the tibia medially rotates a little bit. When the tibia medially rotates just a little bit, it's enough to unlock the mechanism of the knee. The knee does lock, it locks out. That's what helps us with our gait cycle. The knee locks. It locks when the tibia externally rotates. When it medially rotates, it unlocks it. So the popliteus is the key that unlocks the knee. In order to initiate knee flexion, it first medially rotates the tibia. That's the popliteus. Now, what I'm going to show you next is a view of dissecting these superficial muscles out of the way. So we're going to dissect the gastroc, the soleus, and the plantaris. We're going to remove those so we can see what's deep to them. What's deep to them, we could see a little bit of these muscles here. They are posterior leg muscles. You could see that they wrap around the medial malleolus, right? This is the fibula right here. This is, let me take a look and see where we are. Here is the tibia, my bad. Here's the tibia. We're looking at it medially. This is the medial malleolus. And here we have some tendons, and it looks like we have a nerve and an artery that pass behind the medial malleolus, and it goes underneath the foot. Okay, so it's going to be like muscles that are on the medial forearm that crosses the wrist to get to the fingers. We have muscles of the posterior leg that cross the ankle on the inside and go underneath the foot. We'll take a look and see what those are. I call them Tom, Dick, and Harry muscles. Tom, Dick, and Harry. So let's take a look. Let's take a look at Tom, Dick, and Harry right here. Okay, so here's the posterior knee. We dissected away the superficial compartment, the gastrocnemius, both medial head and lateral head. The soleus and plantaris have been removed. You could see a little bit of the foot here. You could see the calcaneus. And now here's the popliteus. That's that diagonal muscle, the key that unlocks the knee. And now there's Tom, Dick, and Harry. Tom, Dick, and Harry is an expression. T is for Tom, D for digitorum, and Harry for Halicus. Tom, Dick, and Harry. What's the an? Tom, Dick, and Harry? It's the tibial artery and tibial nerve. So posterior to the medial malleolus is Tom, Dick, and Harry in that order. In the order from anterior to posterior, it's Tom, tibialis posterior, Dick, flexor digitorum longus, an, tibial artery, tibial nerve, Harry, flexor halicus longus. So it's Tom, Dick, and Harry. In terms of the belly of the muscles, you can see tibialis posterior is here. It's kind of sandwiched between both flexor digitorum and flexor halicus longus. The belly of the flexor halicus is lateral, but then it inserts on the great toe, which is medial. Again, it's a similar thing to extensor halicus longus, the one in the front. It's a lateral muscle that attaches to the inner toe. And because there's that line of pull that goes from lateral to medial, it creates the bunion formation. So the flexor halicus longus, the belly of the muscle, is lateral on the leg, but the insertion of the tendon is medial onto the great toe, which is halicus. So those are the posterior muscles. Now, because these muscles are posterior, they are responsible for foot or ankle plantar flexion, but because they are on the inside of the ankle, they're responsible for foot inversion. Remember, if it was on the lateral ankle, it does foot eversion. When it's on the inside of the ankle, it's foot inversion. Let's look at the lateral hip now. And when we're looking at the entire lower extremity from the outside, we can see some of the anterior muscles and some of the posterior muscles. So here is a great view of the iliotibial band. So here's the ilium, here's the tibia. So here's the iliotibial band, also known as the iliotibial tract. So you can see a little bit of the tensa fasciae latae that inserts on it, but we can also see the gluteus maximus that inserts on it. So TFL flexes the hip because it's anterior. Gluteus maximus extends the hip because it's posterior. And gluteus maximus abducts the hip because it's more in the middle. Because we're looking at the thigh from the lateral view, we can see the quadricep muscle that is lateral. That's the vastus lateralis. And we can see the hamstring muscle that is lateral. That's the long head of the bicep femoris. On the leg, we can see the gastrocnemius, lateral head. We can see the soleus, just the lateral part of the muscle here. And then on the lateral leg, this is two new muscles that we haven't talked about yet, but on the lateral compartment of the leg, we have the Peroneus brothers. There's the Peroneus Longus and Peroneus Brevis. Sometimes certain textbooks refer to Peroneus as fibularis because it's on the fibular side. So the Fibularis longus is superficial, and the Peroneus Brevis, right, the Fibularis longus or Peroneus longus is superficial. The Peroneus Brevis is deeper to it. And these two muscles are on the lateral side of the foot. So they can evert the foot or foot eversion. They can also plantar flex. So they plantar flex and evert the foot. Here's a close-up view again. Here's the gastrocnemius, here's the soleus, and here's a close-up view of the Peroneus longus and Peroneus brevis. So right here is the Peroneus longus, and then on this side and on this side is the Peroneus brevis. So right here, this tendon is the Peroneus longus, and this tendon here is the Peroneus brevis. What Peroneus longus is doing, it's called longus because it is a really long tendon. It starts on the lateral side of the leg, goes behind the lateral malleolus, goes underneath the foot, and creates like a stirrup, like a horse stirrup when you put your foot through a horse stirrup, and it goes to the medial side of the foot. It actually inserts on the first cuneiform and the first metatarsal. So that's why it's such a long tendon. The brevis is a short tendon. It's just going right here to the base of the fifth metatarsal. But they both evert the foot. Okay, the only thing left that we have to look at is the medial compartment here. So here's the medial compartment. Now, one of the things that I told you before was that if we're looking at muscles on the inside of the thigh, they're adductors. If you're looking at muscles on the outside of the thigh, they have to be abductors. So that's why gluteus medius is an abductor. But these muscles, like adductor longus, gracilis, adductor magnus, these inner muscles here, these are adductors, hip adductors. You heard me mention the pes anserine, and I said the sartorius, longest muscle in the body, gracilis, second longest muscle in the body, and the semitendinosus all insert on the same place called the pes anserine, which means goose foot. So sartorius, let's look at it. Here's the sartorius. It inserts on the pes anserine. Gracilis, let's look at it. It comes down here and inserts on the pes anserine. And then let's look at the semitendinosus. Here, it too inserts on the pes anserine. What is the pes anserine? It is posterior and medial to the tibial tubercle. Here's the tibial tubercle, that bump. So right here is the pes anserine. Here's the medial head of the gastroc. Here's the soleus. Here's the medial malleolus. So we can see a little bit of Tom, Dick, and Harry. The tibialis posterior, the flexor digitorum longus, tibial artery, tibial nerve, and flexor hallucis longus all are behind or posterior to the medial malleolus, Tom, Dick, and Harry. Remember, the sartorius is your Faber muscle. It flexes, it abducts, and externally rotates the hip. The vastus medialis, that's your quadricep muscle. It does leg extension or knee extension. Adductor longus, gracilis, and adductor magnus, these are hip adductors. Semitendinosus and semimembranosus, these are two of the medial hamstrings. And they, since they cross the hip, they extend the hip. Since they cross the knee, they flex the knee, or knee flexion. Okay, let me make sure I covered all of these muscles for you. We did the front, yes, and yes. We did the lateral view, the lateral hip, the lateral leg. We did the posterior limb. We focused on the posterior thigh. We did the posterior leg here. We did the medial compartment. We showed you the posterior compartment with the gluteus maximus cut. And then we did the posterior leg as well. Great. We pretty much covered everything. Let me stop the recording here and see if we have any questions.